Hello everyone, welcome to our rationalization for semifinals, and this is Nursing Practice 5, care of clients with physiologic and psychosocial alterations, Part C, E1, care of adult clients with mood disorders and suicide. Let's begin with question number 1. A client received electroconvulsive therapy 15 minutes ago. After returning, Ago is returning to the unit. The nurse observes the client beginning to rouse, which action represents the immediate priority for the nurse: orienting the client to surroundings and providing reassurance, evaluating the client's memory recall before and after treatment, ensuring an open airway and preventing aspiration, checking the insertion site of the intravenous line. Of course, the most significant answer here is actually on prioritization, and that is letter C, because our immediate post-operative care for client following ECT is focusing on ensuring an open airway and preventing aspiration. Once initial physical safety is established, the nurse should then provide reassurance and orient the client to their surroundings. Number 1, the answer, letter C. Number 2, a client diagnosed with bipolar 1 disorder in manic state exhibits grandiose behaviors, attempts to organize a high stakes business deal by phone, and reports needing only 2 hours of sleep per night. Which nursing diagnosis is most critical priority for this client? Disturbed sleep pattern, disturbed thought processes, risk for self directed violence, or risk for injury? Of course, the answer here is safety is our priority because there is grandiosity and attempts to organize high stakes and reports needing 2 hours of sleep per night. The answer is delta. And of course, the client's manic presentation includes grandiose behaviors and increased pleasure seeking, such as high risk, like the business deal. While disturbed thought process and sleep are present, the overall hyperactive high risk presentation suggests the priority nursing diagnosis must be addressed immediately because that is physical safety issue, which is classified as risk for injury. Number 2, answer delta. 3. The nurse uses the sad person suicide assessment scale for a client expressing current societal ideation. The client scores 6 points based on the skill criteria. Based on the scoring defined at the source, what is the most appropriate action for the nurse to anticipate? The client may stay at home with the assistance of significant others and outpatient treatment. The client requires hospitalization. There is a strong consideration for hospitalization. The client needs more intense outpatient treatment with support from significant others. The answer here is Charlie, because a score of 5 to 6 points on the sad person scale warrants a strong consideration of hospitalization, and hospitalization is typically warranted at 7 points. A score of 3 to 4 suggests possible hospitalization, more intense outpatient treatment, while 0 to 2 points allows the client to stay home with assistance and outpatient treatment. Number 3, answer Charlie. 4. A client's beginning treatment for depression with a seasonal component or seasonal affective disorder. The client's depressive clinical manifestation occur primarily in the winter months. When should a nurse instruct the client to begin using phototherapy? A. Only during the peak winter months, December through February. During the summer months to build up reserves of light exposure. In late afternoon hours to match the time when symptoms typically peak, or beginning in August or September through April. Of course, the answer here is letter D, because clients with seasonal components to depression experience clinical manifestations primarily in the winter months, and the nurse should instruct the client to begin using phototherapy in August or September and continue through April. Phototherapy should also be provided in early morning hours to produce maximum benefit. Number 4, the answer is D. 5. A client with bipolar 2 disorder has seasonal affective component superimposed on their diagnosis. The provider provides phototherapy to prevent triggering a manic episode, which should a nurse schedule this treatment early morning hours or immediately after awakening, late afternoon hours, midday during peak high intensity or light intensity, or immediately before bedtime. The answer here is bravo. So when the client has bipolar disorder and has session-affective depressive superimposed, light therapy needs to be utilized in late afternoon hours to avoid triggering a manic episode. Number 5, answer bravo. 6. A nurse providing education to a client diagnosed with premenstrual dysphoric disorder, or PMDD. Which dietary instruction should the nurse include in the client's care plan? increased consumption of caffeinated beverages and chocolate, decreased intake of water and juice during the luteal phase, decreased sodium intake, or take vitamin B12 supplements daily. Of course, the answer here is letter C. Because, of course, one of the nursing interventions for PMDD includes the client to decrease sodium intake. So the client also be encouraged to increase their intake of water and juice and avoid caffeinated containing beverages and chocolate. And the nurse may administer vitamin B6, 100 milligram per day, for 2 weeks prior to the menstrual cycle as prescribed. Number six, the answer, Charlie. Seven, during a suicide assessment using the sad person's framework, the nurse determines that the client possesses an organized plan, including the method, time, date, place, and fantasies about who would find them. Based on the assessment criteria, which factor does this finding most significantly indicate? A. Decreased likelihood of social support. B. Increased risk due to rational thought loss. Or C. Increased lethality of the method. Or letter D. High risk due to sickness or terminal illness. The answer for number seven is Charlie, because the component of an organized plan within the suicide assessment scale includes the lethality of the method, the time, date, place, and fantasies, including who would find them, funeral, and grief of significant others. 7. C. 8. A client diagnosed with major depressive disorder reports significant fatigue, feeling of worthlessness, and difficult completing basic hygiene tasks like showering. Based on these assessment findings, which nursing diagnosis would the nurse prioritize? Ineffective coping, self-care deficit, disturbed sleep pattern, or interrupted family processes? The answer here is letter B, self-care deficit. Of course, the assessment findings present of fatigue and feelings of worthlessness are clinical manifestations of major depressive disorder, and difficulty completing basic hygiene tasks indicates an inability to perform self-care. Therefore, the most appropriate nursing diagnosis to prioritize based on the ability to perform hygiene is self-care deficit. Answer: Bravo. 9. The nurse is preparing a client for ECT procedure scheduled for the next morning, which instruction is essential to prepare in the pre-procedure teaching and preparation. Inform the client that memory loss is unlikely to occur with unilateral electrode placement. Instruct the client to take prescribed oral medications before midnight, or ensure the client is NPO after midnight, or verify that the client has a family member present to witness consent. Of course, the answer here is letter C. So, pre-procedure electroconvulsive therapy preparation requires ensuring that NPO after midnight prior to the procedure. And the nurse must also obtain written consent and conduct a memory assessment. And the client should be instructed that memory loss may occur for a short time before and after treatments, even with unilateral placement, which only assists with decreased memory loss but may be less effective. 9. Charlie. 10. A client is experiencing a mixed mode episode exhibiting both manic and major depressive clinical manifestations for most days. Within 1 week period, which category of medication is the nurse most likely to administer to address this specific episode? Antidepressant drugs, sedative hypnotics for sleep, dysregulation, mood stabilizing medications such as lithium, phototherapy for rapid elevation. The answer here is Charlie. Because a mixed mode episode is a feature of bipolar 1 disorder, and nursing intervention for mixed mode episode specifically include administering mood stabilizing medications such as lithium, gabapentin, or carbamazepine. The answer for number 10, Charlie. 11. A client began phototherapy 4 days ago for seasonal depression. The client asked the nurse how soon they can expect to feel the full benefit of the treatment. What is the most accurate information the nurse can provide based on the therapy timeline? Maximum antidepressant benefit occurs within 4 days. Maximum full antidepressant benefit is maintained within 30 minutes fully daily session after 2 weeks. Our maximum antidepressant benefit occurs in 2 weeks of therapy, or the beginning antidepressant response is usually felt in 4 weeks. Of course, the answer here is Charlie. The beginning antidepressant response occurs within 4 days. However, the maximum antidepressant benefit occurs in 2 weeks of therapy, and full benefit is then maintained within 30-minute daily session. Answer here is Charlie. 12. The nurse reviewing the assessment data for client with MDD notes that the client often has delayed sleep onset and a shortened rapid eye movement latency observed during an electroencephalogram. The nurse recognizes that these findings are associated with which biological factor? A. Dysregulation of circadian rhythm, small frontal lobes, and smaller caudate nuclei, increased levels of serotonin and norepinephrine, and underlying autoimmune disorder. The answer here is alpha. Because abnormal electroencephalograms, specifically delayed sleep onset, initial for insomnia, shortened rapid eye movement, latency, and increased length of the first REM period are indicators of dysregulation of circadian rhythms, and these are noted under the biological factors associated with mood disorder. Number 12, answer alpha. So it's the same slide. Let's proceed to the next question, which is focused on care of client care of adult clients with personality disorder. Question 13. A client with antisocial personality disorder is assessed as being manipulative, engaging in unlawful behavior, and failing to conform to social norms. The client also lacks a sense of shame, attempts to justify breaking unit rules by blaming another client, which nursing intervention is the highest priority in managing this client's behavior and maintaining that therapeutic milieu. Providing information to the client in a task oriented manner, offering the client praise for positive behavior exhibited in social settings, instructing the client to keep a daily journal of her feelings, setting clear and consistent limits for the client's behavior. 13, the answer here is D, because clients with antisocial personality disorder considered are often guiltless and exploitative, displaying manipulative and irresponsible behavior, and disregarding the rights of others, and due to their failure to conform to norms and propensity to blame victims. Setting limits for the client's behavior is crucial to prevent violation of rules, maintain safety, and provide a framework for appropriate conduct. While other interventions may be used, limit setting directly addresses the core behavioral disregard for boundaries. 13, answer Delta. 14. A nurse is reviewing assessment data for a client diagnosed with borderline personality disorder who describes feeling empty inside and has a history of past physical, emotional, sexual abuse. The client's record notes that suicide threats and attempts are made and self-mutilation is common. Given these findings, which nursing diagnosis takes immediate priority? Impaired social interaction, risks for other directed violence, ineffective coping, risks for self-directed violence. Of course, the answer for this one is for clients with borderline personality disorder, assessment specifically highlights that suicide threats and attempts are made and that self mutilation is common. These behaviors fall under the umbrella of risk for self directed violence and necessitate the immediate intervention of attempting to prevent the client from self destructive behaviors. This safety concern supersedes other diagnoses like ineffective coping or impaired social interaction. Answer 414 is letter D, risk for self-directed violence. 15. A client diagnosed with schizoid personality disorder is described as socially isolated, a loner who lacks a desire for intimacy and is detached from interpersonal relationships. When the nurse approaches the client with intervention, should the nurse prioritize to foster a therapeutic relationship and optimize communication? Answer here is Delta. Let's provide information to the client in a task oriented manner. Clients with schizoid uh, personality disorder lacks social skills and desire for intimacy, preferring intellectually involved tasks. And to effectively communicate and engage this client, the nurse should utilize a style that respects their detachment and focus, such as providing information in a task oriented manner. While limiting large groups is also an intervention, communicating effectively in a task oriented way is the most effective approach for initial engagement and information delivery. Next, number 16. A client with paranoid personality disorder misinterprets the actions of others as a direct threat and displays generalized unwarranted Suspiciousness, often feeling that there is a hidden meaning to interactions, which nursing intervention is most essential to mitigate the client's hypersensitivity to perceived criticism and potential hostility. A. Instructing the client to keep a daily journal of her feelings. B. Administering psychotropic drugs as prescribed. C. Being clear in identifying what the client can expect and what is expected of her. Or D. Informing the client about the consequences of her action. Answer here is Charlie. Because the client's core issue is generalized suspicion and misinterpreting others' motives as underhanded or threatening. Clarity regarding expectations, what the client can expect and what is expected of her, is essential to reduce ambiguity and decrease the likelihood that the client will perceive hidden meaning or threat in the nurse's communication or the unit routine. Answer for 16, Charlie. 17. A client with historic personality disorder exhibits excessive emotionality and attention-seeking behavior. If the client is not the center of attention, she will do something dramatic to regain focus, which nursing intervention, specifically aimed at snap shaping positive interaction patterns, is most appropriate. Set limits for the client's behavior, offering the client praise for positive behavior exhibited in social settings, or limiting large group social interactions, or informing the client about the consequences of her behavior. Answer here is bravo. Because since the client craves attention and will be dramatic if not centered, the goal is to reinforce acceptable social behavior. And offering praise for positive behavior exhibited in social settings is a direct application of positive reinforcement, ensuring that appropriate non-dramatic interactions receive the desired attention, thus reducing the need for excessive emotionality. So number 17 is letter B. Number 18. A client with narcissistic personality disorder displays grandiosity, manipulativeness, and an arrogant condescending attitude. This client is also noted to be hypersensitive to criticism and readily blames others. When the client violates a unit rule, which intervention is critical for fostering accountability while minimizing defensive blaming. A. Instructing client to keep a daily routine or journal feelings, encouraging client to be as independent as possible, informing client about the consequences of her behavior, or providing information to the client in a task-oriented manner. Answer here is letter C. Clients with narcissistic personality disorder often display grandiosity and readily blame others when challenged or criticized. To manage accountability without enabling manipulation or blaming, the nurse must ensure the client understands the link between actions and outcomes, inform the client about the consequences of her behavior, clearly outlines boundaries and structures, which is vital when dealing with manipulated behavior and arrogance. 18. Charlie. 19. A client with borderline personality disorder exhibits an unstable mood, unstable affect, and marked impulsivity. Given the definition of personality disorder as traits that are inflexible and maladaptive, which standard nursing intervention best describes the client's struggle with internal emotional instability, attempting to prevent the client from self-destructive behavior, instructing the client to keep a daily journal of her feelings, administering psychotropic drugs as prescribed, limiting large group social interactions. The answer here is bravo. Although preventing self-destructive behavior is critical for safety, instructing the client to keep a daily journal of her feelings is a specific cognitive behavioral intervention designed to help the client identify, label, and potentially manage her unstable affect and mood, a key aspect of improving emotional regulation and coping mechanism. So number 19 is letter B. Number 20. A client diagnosed with dependent personality disorder shows a pattern of submissive and clinging behavior related to an excessive need to be taken care of. Assessment reveals the client's fears being left to care for herself and lacks self-confidence, which nursing intervention is most critical for addressing the associated nursing diagnosis of ineffective coping. setting limits for client's behavior, encouraging client to be independent as possible, administering psychotropic drugs as prescribed, offering a client praise for positive behavior exhibited in social settings. Answer here is letter B. Because for clients with dependent personality disorder, clients lack self-confidence, there's fear for themselves, and usually have others assume responsibility for major areas of life. An intervention most directly and counteracting this dependency pattern is encouraging the client to be as independent as possible, which works towards building self-confidence and decreasing their excessive need for nurturance. Number 20, the best answer is letter B. Number 21, a nurse is working on a client diagnosed with schizotypal personality disorder who exhibits cognitive or perceptual distortions and often has ideas of reference or believes she has magical powers. The nurse needs to explain the schedule for the day to prevent the client from becoming preoccupied with paranormal phenomena or special meanings. The nurse should implement which intervention, encouraging the client to keep a daily journal of her feelings, offering the client praise for positive behavior exhibited in social settings, providing information to the client in a task oriented manner, or limiting large group social interactions. The answer here is Charlie. Clients with schizotypal personality disorder have deficits in interpersonal relationships and exhibits cognitive distortions. By utilizing a task oriented manner and providing information, the nurse maintains focus on reality and structure, reducing the opportunity for the client to impose idiosyncratic meaning or cognitive distortions onto the interactions of or the environment. 21, the answer is letter C. Number 22, a client with avoidant personality disorder displays shyness, a low self-review, and an oversensitivity to rejection, leading to avoidance of activities and limiting relationship with others. The client is fearful of rejection and expects to be criticized. Considering the nursing diagnosis of impaired social interaction, which nursing intervention is initially most suitable? Encouraging the client to be as independent as possible, limiting large group interactions, setting limits of the client's behavior, inform the client about the consequences of her behavior. The answer here is Bravo. The client's core issue is extreme social inhibition and oversensitivity to potential rejection, causing them to limit relationships. To slowly facilitate social interactions while managing anxiety and fear of criticism, the nurse should limit large group social interactions. This allows the client to potentially engage in smaller, less threatening settings, thereby addressing impaired social interactions in a manageable way. 22. Answer Bravo. 23. A client with OCPD is described as rigid, perfectionistic, and preoccupied with details, rules, plans, and organization. The client's interpersonal control stems from unconscious dependency and she lacks spontaneity. When attempting to introduce flexibility and self awareness, which intervention is most challenging but potentially effective, providing information to the client in a task-oriented manner, instructing the client to keep a daily routine journal of her feelings, setting limits for the client's behavior, administering psychotropic drugs as ordered. Answer here is Bravo, because clients with OCPD are rigid and preoccupied with external orders and rules. Asking them to journal about feelings directly challenges their focus on external control and structure, forcing them to engage with the internal emotional content they unconsciously seek to control. This intervention promotes insight into the emotional instability underlying their rigid traits, which are maladaptive. 23. Answer Bravo. 24. Low serotonin levels are related to suicide, depression, impulsiveness, and aggression. A client in cluster B, which includes disorders common in biological relatives of clients with depression, bipolar disorders, and substance abuse, exhibits impulsivity and aggression, which nursing intervention is directly supported by biological data provided in the source, encouraging the client to be as independent as possible, attempting to prevent the client from self-destructive behavior, administering psychotropic drugs prescribed, offering the client praise for positive behavioral exhibited in social settings. The answer here is Charlie, and that links to low serotonin levels, to impulsiveness and aggression, since psychotropic drugs often target neurotransmitters like serotonin. The intervention of administering psychotropic drugs as prescribed is the only option directly addressing the identified biological influence on impulsivity and aggression mentioned in the question. 24 answer Charlie. 25. A newly admitted client exhibits eccentric behavior and deficits in interpersonal relationship. The client states that the television is sending her special messages, a, a potential cognitive distortion based on the general description of personality disorders. SWOT assessment finding confirms the client's diagnosis is not a primary psychotic disorder. The client demonstrates extreme set of personality traits. The personality traits are stable over time. The client lacks insight into behavior. The client stays in touch with reality. Of course, the answer here is delta. While some personality disorders like schizotypal involve cognitive distortions and even neurosis, psychosis bordering, the general description of personality disorders confirm that clients stay in touch with reality. This is the critical differentiation from a primary psychotic disorder, which involves profound break from reality. So number 25, the answer is letter D. Let's proceed now to another set of exam, and that is letter E, 3, care of adult client with addiction. 26. A client is admitted to the medical floor exhibiting severe signs of alcohol withdrawal, including hypertension, tremors, and agitation. The nurse notes new symptoms, marked confusion and coordinated movement, and an unsteady gait. The healthcare provider has an order intravenous fluids, chlordiazepam oxide, 10 milligram PRN for withdrawal symptoms, and thiamine 100 milligram IV stat. This intervention should the nurse prioritize immediately based on the client's newest clinical manifestation. The answer here is letter B. Administer thiamine 100 milligram IV stat to prevent irreversible neurological damage. The client is exhibiting already classical manifestations of Wernicke-Korsakoff syndrome, wherein there's presence of marked confusion, unsteady gait, and coordinated movement, which is caused primarily by the deficiency in thiamine. Prompt treatment with large amount of thiamine is required within the first few hours to the first few days of onset of clinical manifestations. If not given within this time period, death may result or the client may develop marked impairment of memory. While chloride oxide is essential for managing motor symptoms, addressing the thiamine deficiency is a time critical priority to prevent severe, potentially irreversible neurological sequelae. 26. Answer Bravo. 27. A nurse in the emergency department receives a client who recently ingested an unknown quantity of an opioid. Assessment findings include profound drowsiness, low speech, and respiratory depression. The nurse says immediate priority goal is to prevent mortality, which tending nursing intervention is the most critical action to achieve this goal. Elevate head of the bed to encourage spontaneous orgasm and improve respiratory effort. Administer naloxone as a prescribed antidote for an opioid overdose. Provide comfort measures to alleviate the symptoms of analgesia and apathy. Monitor vital signs every 15 minutes, noting the presence of flushing and itching. The answer here is Bravo, because death from an overdose of opiate or an opiate is generally due to respiratory arrest from respiratory depression effect of the drug. The nurse intervention for opioid intoxication includes assessing the respiratory depression and administering naloxone or Narcan as the antidote for an opioid overdose. 27. Bravo. 28. A nurse is conducting an assessment for a client who reports heavy alcohol use over the past 2 years. The client's current assessment findings include a decreased blood pressure, decreased respiration, slurred speech, and slowed thought processes. Based on these findings, the nurse should conduct or conclude the client is Currently experiencing which substance related phenomenon? Early alcohol withdrawal, alcohol intoxication, alcohol dependence requiring immediate detoxification, chronic liver cirrhosis resulting in portal hypertension. The answer here is Bravo. Alcohol intoxication is characterized by CNS. The present effects of alcohol. Specific assessment findings listed for alcohol intoxication include blood pressure decrease, respirations decrease, slurred speech, and slowed thought processes. In contrast with alcohol withdrawal is characterized by CNS hyperactivity, resulting in increased BP, increased respiration, and hyperactive thought processes. 28. Bravo. 29. A client admitted for sedative dependence as a nurse why the physician has prescribed a different CNS depressant, a benzodiazepine during the detoxification period, stating, I thought I was supposed to quit all drugs. The nurse's response is best supported by which rationale drawn from the medical management protocol for sedative hypnotic or anxiolytic withdrawal. A. Benzodiazepines is given simply to induce rest and relieve insomnia. The goal of using different classes of depressant is to avoid cross tolerance and dependence on the original substance. The benzodiazepine is administered for this detoxification protocol, followed by tapered dosages to safely manage withdrawal symptoms, but the client requires a barbiturate instead, as benzodiazepines are only used for alcohol withdrawal. The answer here is Charlie. Because medical management for sedative, hypnotic, or anxiolytic withdrawal requires administering benzodiazepine per detoxification protocol, followed by tapered dosages for sedative hypnotic or anxiolytic dependence. Detoxification is accomplished by using a prescribed CNS depressant in tapering dosages. These methods safely manages the severe physiological symptoms of withdrawal. Answer C. 30. A client admitted for amphetamine dependence and is currently experiencing acute withdrawal, presenting with fatigue, depression, and psychomotor retardation. The client reports extreme difficulty resting. To promote recovery and manage the clinical manifestations during this withdrawal period, the nurse should prioritize which intervention, provide a quiet and non-stimulating environment for the client, promote abstinence by immediately instructing the client on sleep hygiene techniques, encourage psychomotor agitation through recreational activities to counter the fatigue, instruct the client on relaxation techniques such as deep breathing and guided imagery. Answer Alpha. Nursing interventions for amphetamine and cocaine withdrawal include providing a quiet and non-stimulating environment for the client. Although sleep hygiene is an intervention for intoxication, the priority for withdrawal management, especially when fatigue and difficulty resting are present, is environmental control to facilitate recovery. 30. Alpha. 31. A client with alcohol dependence is preparing for discharge and will be starting disulfiram or antabuse therapy. The client says, I know I can't drink alcohol while on this medication, but I'm worried about accidentally triggering the reaction. Which item, when mentioned by the client as a potential concern, requires immediate follow-up education regarding hidden sources of alcohol? A. Drinking regular coffee to maintain alertness. B. Eating a balanced diet with fresh fruits and vegetables. C. Using steroids or NSAIDs for minor aches. Or D. Using certain brands of mouthwash and cough syrup. Answer Charlie. Because the nurse must inform the client of other sources of alcohol that can trigger the antabuse reaction, specifically listing cough syrup and mouthwashes. 31. Letter D. 32. A client has used lysergic acid diethylamide yesterday is now experiencing severe anxiety, paranoia, and recurring visual illusions or flashbacks. The nurse recognizes the need to manage a client's perception disorder and severe anxiety. The most effective nursing intervention strategy would be to medicate immediately with an opioid antagonist like clonidine to block receptor sites. Instruct the client to try to ignore the visual illusions as they are not real. Provide reassurance and assist the client with reducing anxiety through decreased lighting and environmental stimuli, and focus on hydration and neurological assessment, preparing for potential seizures. The answer here is Charlie. For hallucinogen intoxication such as LSD, nurse interventions include talking calmly, reassuring client safety, and educating on anxiety reduction. For hallucinogen persisting perception disorder or there's presence of flashbacks, the nursing goal is to ensure safety, provide reassurance, and assist with reducing anxiety by decreasing lighting and environmental stimuli and utilizing deep breathing techniques. 32. Answer Charlie. 33. The nurse has provided extensive interpersonal skills training to a client diagnosed with alcohol dependence, which in statement by the client best indicates the effectiveness of the teaching regarding problem solving and coping skills. A. I know that my genetics mean I'll always struggle with alcoholism. B. When I feel anxious, I immediately call my sponsor for support. When I catch myself thinking negative self talk, I substitute that thought with a plan for pleasant activity or relaxation. I am practicing nonverbal communication skills when speaking to others. Answer Charlie. Interpersonal skills training, including problem solving, coping skills, awareness, and management of negative self talk, increasing pleasant activities, and relaxation training. And option C is actually demonstrating the client's ability to utilize several of these interpersonal skills. And letter B and D relate more closely to interpersonal skills, strengthening social support networks and nonverbal communication. 33 is letter C. 34. The nurse is assessing a long term alcoholic client and notes the client's medical charts lists several medications, including severe stomach acid production and inflammation of the pancreas. The nurse anticipates documenting clinical manifestations consistent with each pair of alcohol induced medical complications: brain atrophy and esophageal varices, gastritis and pancreatitis, portal hypertension, cardiac arrhythmias, Wernicke-Korsakoff syndrome, and peripheral neuropathy. Of course, the answer here is letter B, because alcohol causes an increase in production of stomach acid, leading to gastritis. Pancreatitis is defined as inflammation of the pancreas, which clinical manifestations include abdominal pain, nausea, and vomiting. 34 answer, bravo. 35. A client presents to the clinic with persistent legal issues related to driving under the influence and reports being unable to fulfill major responsibilities at work and home due to substance use. The client denies withdrawal symptoms or tolerance based strictly on the defining characteristics provided in the sources. The nurse should chart this client's pattern of substance use as primarily meeting the criteria for substance dependence, substance withdrawal, substance intoxication, or substance abuse. Answer Delta. Because substance abuse is defined as a maladaptive usage pattern causing significant distress or impairment, specifically during the inability to fulfill major responsibilities at home, work, or school, and persistent legal problems related to use of a mood-altering substances. Substance dependence requires three or more characteristics, including tolerance or withdrawal clinical manifestations, which this client denies. 36. A client is experiencing opioid withdrawal characterized by elevated temperature and abdominal spasm, chills, and diarrhea. The nurse goal is to provide management of the clinical manifestations and alleviate discomfort. Which combination of nursing intervention is most aligned with the source's instruction for managing this specific physical manifestation? Encouraging rest and administering a CNS depressant like chlorodiazepoxide, encouraging warm whirlpool baths, providing warm blankets, and promoting adequate hydration, assessing vital signs every 2 to 4 hours, and discouraging food intake to limit diarrhea, administering an opioid antagonist clonidine only if the symptoms subside. Answer here is bravo. Because the goal of opioid withdrawal treatment is to focus on the alleviation of discomfort and management of clinical manifestations. Specific comfort measures listed include providing the client with warm blankets to assist in alleviating chills, encouraging warm whirlpool baths, and promoting adequate hydration. 36. Bravo. 37. A nurse suspects a client is impaired after noticing that the narcotic count was inconsistently incorrect on the last three shifts. The clients under the colleague's care frequently request repeat dose of pain medication without reporting adequate relief. According to professional guidelines outlined by the source, what is the primary responsibility of the nurse observing this behavior? Approach the impaired nurse with documentation and offer support before involving management. Ignore the discrepancy as the impaired nurse will likely deny the impairment. Perform an assessment of the colleague for alcohol breath and inability to concentrate or report a suspected impaired nurse while continue to document the observed behavior. Answer here is letter D. It's the responsibility of the coworker to report a nurse who is suspected of stealing drugs in the nursing unit. The nurse must also keep and check the narcotic count and document the impaired nurse's behavior. Then assessment criteria used to identify the problem, which is narcotic count wrong, and client failure to report pain relief are inaccurate. Offering support comes after reporting the documentation. That is number 37. And that's it. Thank you so much, everybody.